Hello, my name is Dr. Diwan S. Raja. Today I will discuss multiple choice questions in insulin and oral anti-diabetic drugs. Let's start. Question number 1. A 60-year-old man with type 2 diabetes had a hard time controlling blood sugar levels through diet and exercise. His primary care physician has prescribed him metformin 500 mg twice daily. Which of the following statements is characteristic of metformin? Okay. Metformin increases appetite and body weight. Metformin raises the risk of cardiovascular disease. Metformin cannot be used with insulin. Metformin inhibits hepatic gluconeogenesis. Metformin absorbs slowly and is bound to plasma protein. Out of these, this will fit here. Metformin inhibit hepatic gluconeogenesis. Okay, so it does not increase appetite, does not increase body weight. It actually decreases risk of cardiovascular disease. It can be used with insulin in combination and also with other oral anti-diabetic drug, but metformin inhibits hepatic gluconeogenesis. Metformin absorbs slowly. No, it is absorbed easily and is bound to the plasma protein. No, it does not bound to the plasma protein. It is absorbed well and it is not bound to the plasma protein. Answer should be here. Metformin inhibits hepatic gluconeogenesis. Gluconeogenesis is the production of glucose from sources other than carbohydrate. Question number 2. Which of the following insulin preparations has a slower onset of action with no peak and has a flat, prolonged hypoglycemic effect for more than 24 hours? Regular insulin, glargine insulin, lisproinsulin, glucine insulin, NPH insulin. Answer should be what? Glargine insulin. It has no peak, it goes constantly and for prolonged period. Glargine insulin. Question number 3. Which of the following are the counter-regulatory hormone to insulin that often decrease in secretion in long-term diabetics except one? The exception is what? It is not all of them are counter-regulatory hormone except one. Glucagon, counter-regulatory hormone. Epinephrine, counter-regulatory hormone. Vasopressin, no, it is not the counter-regulatory hormone. Cortisol, counter-regulatory hormone. Growth hormone, counter-regulatory hormone. So our answer should be C, vasopressin, also called antidiuretic hormone. Okay, here all of the following statement about the thiazolidinediones TZDs are correct except one. The exception is where TZDs are insulin sensitizer and lower insulin resistance. That is correct statement. TZD do not promote insulin release from the pancreatic beta cell. That is also correct. TZD are well absorbed and are bound to plasma protein. That is correct. TZD are the drug of choice for type 1 diabetes. No. For type 1 diabetes, we always use the insulin. No oral anti-diabetic drug for type 1 diabetes. So our answer is this. D is the answer. D is the answer of question number 4. D. Okay, so we got that. Now we go to the question number 5. A 62-year-old man with history of type 2 diabetes is diagnosed with hepatic toxicity. Which of the following drug would be a poor choice for controlling his diabetes? Okay, troglytagen, acarbose, miglitol, regular insulin. Answer should be A, troglytagen. In hepatic failure, it should be contraindicated, and also the liver, once it is in the system, we should take care of the liver function test of the patient. We should regularly check up the hepatic function test, liver function test to a patient who takes the anti-diabetic drug. So it is a relative contraindication here for the troglytagen. It should not be given for control of diabetes. Answer should be A, 5A. Question number 6. All of the following are contraindication to metformin except one. The exception is what? Polycystic ovarian disease, hepatic disease, kidney disease, alcoholism, cardiac and respiratory insufficiency, all of which are contraindicated except one. What is the exception? Exception is the polycystic ovarian disease. In this condition, the metformin may increase the sensitivity of the insulin, okay, and it will stimulate, this way it will stimulate the ovulation, and this is a treatment for polycystic ovarian disease. Okay, so suppression of insulin resistance will not present, so that will help in ovulation. Question number 7. Which of the following oral hypoglycemic drug may cause weight loss, decrease hepatic gluconeogenesis, improve lipid profile, and can decrease macro and microvascular disease risk? What is the answer? Tolbutamide, glipizide, glyburide, metformin. Okay, we'll go for metformin. D is the answer. D. Question number 8. All of the following drugs stimulate insulin secretion except one. The exception is what? All of the drugs stimulate insulin, like tolbutamide, glipizide, glyburide, repaglinide, metformin. Okay. Which of the following drugs stimulate? All of the following drugs stimulate insulin except one. The exception is metformin. Answer is E. Okay, that is the answer, E. And that's all about the pharmacology MCQs on insulin and oral hypoglycemic agent. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.